Hi. So our experience as a pulmonary fibrosis caregiver to my husband. Sometimes, if you are frustrated and it takes time to go to the doctor, we usually go to the pharmacy and ask for over-the-counter medications for the cough. And sometimes it's going to be better. It's effective. However, in some cases, it's not. It's dangerous. So the pharmacy gave me like this. And it's going to be okay because I was thinking, oh, it's just cough control and it has there's no RX sign. But if you are going to read carefully at the back, there says something like, if cough, like there's a patient having emphysema or asthma or chronic cough, it's not going to be safe because it stated that, yeah, we really need to ask our doctor's recommendation. Sometimes it's really good to have an over the counter, but the doctor advice is very important because if you have this chronic cough, or my husband was a COPD, chronic obstructive pulmonary disease, and we live in a very far places or a mountainous area wherein it's 127 kilometers away in order to see our pulmonologist. I'm sorry about my English. And we used to have over the counter. It's not good. If you are going to read at the back, it says chronic cough, it's not good. And especially to him, he has a terminal illness that is pulmonary fibrosis. It's not good to have this. It's not good, really. And when we go to our pulmo specialist, she gave me this one, Symbicort Raffihaler. It is a mild one, I guess. It 160 microgram, because as far as I know, there is a 360, or there is 300 something. So it's 120 actuation. So he gave me, or my husband, instructions for usage, twice, 2 puff in the morning and 2 puff in the evening. But if a reoccurring shortness of breath, he's going to take or puff 2 puff every 6 hours. And that means sometimes in a day, we're going to puff 3 times. So some other medications, those are actually empty fuel. That's why I put it in here, but I make sure that everything will not going to be contaminated, because this is going to be trash. I'm going to throw it away. And this is our laxative. It's Castoria, yeah. And sometimes if this one is not going to work because it's a liquid, I expect this one to have work faster than this one. It's tablet, but per experience, this one works better. But it will not work 1 to 2 tablets. No, it's going to be 4 or 5. Oh my God, Lord, it's severe constipation. And of course, my husband is going to be in his senior years. He has his polydent and he has his iron. We must be very careful because sometimes iron, because he's pale and his blood like 90 over something, so we had his iron, but it can cause constipation. That's why we have this one. So whenever you are taking iron, we have to make sure we drink a lot of water. And sometimes we have tea in a form of tea. And that's all. There's a lot that I can share, but maybe this one too. It's Memo Proof. This one is a type of food supplement. However, this has a special purpose in our brain. Supplement for memory, because pulmonary fibrosis patient or my husband had a problem with memory. I'm afraid. I thanks God he never forgot my name. His sisters, his family, and we have the incentive spirometer. And there's a lot more to share. Please consider subscribing my channel because I'm trying to have his medicine for my YouTube. If I'm going to earn, I just started, so I don't know how does it works. I'm just experiment. Sorry about my English.